So my name is Dr. Paul Gallardo. I'm a periodontist in Miami, Florida. We do many all-on-4 style cases, and we get many patients and actually doctors asking us, what is the sequence of events when it comes to an all-on-4 case workup and execution? So basically, step one is a treatment conference with the patient. Very, very important is to meet with the patient and make sure that the expectations that are set out are realistic and that the patient can accept these expectations. So I think it's not just about the teeth, it's about, especially when it comes to these types of cases, about the patient's lifestyle and making sure that we're addressing those issues. Some patients are single and wanting to meet someone. Some patients are seeking a job. Some patients feel like they've taken care of their kids and their grandkids, and now it's their time to do something for themselves. So it's important to understand the person beyond the teeth. So we do that first, explain the procedure. Then step one is to actually schedule impression taking so that we can start fabricating the temporary or the first set of fixed teeth. This is done before the surgery. So the lab will actually receive the records, which means impressions. We take pictures, profile different angles because it's all part of the way the lips and the face frame the teeth. And then we develop a temporary based on that. The temporaries are basically set on the side on the day of the surgery. Patient comes in. They come in taking a light sedative about an hour before the procedure. They come in, we start the IV. So we're actually going to do the whole procedure with IV sedation. So that means that the patient's not going to be aware of the actual occurrences during the surgery, which is something which is very favorable. Once we start the IV, we also draw a few tubes of blood because we want to isolate proteins from the patient's own plasma that's going to help in terms of healing and accelerated formation of bone and soft tissue. So we do all of that. Once the patient is sedated, then we will do the local anesthesia to make sure that they don't feel anything during the procedure. Since there are so many people that are needle phobics, especially when it comes to the dental office, we like to sedate the patient first, then administer the local anesthesia so that they don't even notice the actual Novocaine. We begin the surgical procedure by removing all of the teeth. The patient doesn't even know what's happening. Implants are placed, 4 to 6 implants on the top and 4 usually on the bottom jaw. The restorative dentist can be a prosthodontist or an experienced restorative general practitioner, will come in, take the impression of the implants that I've placed, and then our lab technician will be waiting on the sidelines, ready to receive these impressions and actually start to retrofit the teeth that were made ahead of time to the position, to the very accurate position of the dental implants. So that means that the surgery takes place for a few hours in the morning, patient starts to wake up after the impression taking, and then the actual teeth are delivered by the afternoon. And they are fixed teeth. Now they're a temporary set of teeth, so basically they are intended to, even though they're fixed, they're intended to last for about 6 months. The tissue will undergo some changes, so the gum might shrink underneath the prosthesis, and then at 6 months, the final healing will have taken place. A next or second impression is taken at that point in the restorative dentist's office. That impression is not going to just capture the position of the implants, but it's also going to capture the actual final healing of the anatomy, which is the gum line in the bone. That will then allow the lab technician to make a second set of teeth, which is going to be based on that final healing anatomy. This is going to be very well adapted to the tissue, so there are no gaps between the prosthesis and the gum, so no food will get underneath this prosthesis. And secondly, all the aesthetic concerns or questions or requests from the patient will be addressed at that point. Sometimes patients will want a little bit whiter teeth, sometimes they'll want a little bit darker, a little bit more natural looking. Maybe even the shape can be changed. So this is the point in which all of these changes can be finalized. And then the restorative dentist basically has these final teeth fabricated, typically material either acrylic or zirconia, and then they're delivered in, and that's about it.